The biggest reason people form stones is they're not drinking enough water. I often tell my patients I equate it to basic middle school chemistry, where you do these experiments where you have a beaker of fluid and they have you pour the salt into the fluid. And if you get enough salt in there, it won't dissolve into the water. If you have too much salt, it crystallizes and you can see it. How do you make that dissolve? You pour more water into that beaker. So it's basic middle school chemistry. We tell patients if they're really flushing themselves with fluids, they're less likely to form stones. Kidney stones are very prevalent. They can affect almost anybody, and it's a huge percentage of what we do at Center for Urology. Kidney stones can present in many ways. The classic ways that most people know about are they present with flank pain. That's pain in the back. The pain can then radiate down to the groin. People describe it as a severe pain, almost worse than childbirth. You may present with blood in the urine. You can present with urinary symptoms of frequency, urgency. Some people, even with the tiniest stones, have difficulty passing it. They have work to do. I've operated on pilots, doctors, people who have to get back to work, can't take their pain medicine, and even for a 2mm stone, which is tiny, we'll go in there, we'll get it so that the person can get back to work. The simplest treatment is something called shock wave. It's a special machine that uses shock waves that penetrate, they go right through the body, and they pulverize the stone within the body. There's no incision, there's no cutting, there's no scope. I like both aspects of urology, where I get to do procedures and surgeries which go back to my video game days, but I also get to deal with people and help them through either a problem as bad as cancer or something like kidney stones, which is just a bothersome problem. I used to play a lot of asteroids as a kid. My parents told me I was wasting my time, that it would never allow me to amount to anything. And I will tell you that when we're in there lasering kidney or ureteral stones under direct vision, it's a lot like playing asteroids. I got pretty good at that as a kid.